Learning objectives. After completing this module, learners will be able to define and understand role of government in the health section of India. Describe and understand the ways in which the government in India is trying to implement the various schemes for improving the health situation in India. List and know about the characteristics, public and private healthcare facilities in India.
Role of government in health. Introduction. Health is an important issue for people, and both public and private aspects of health provisioning need to be looked at. Although the Constitution supports a view that the right to health is an aspect of our fundamental rights, it is not necessarily being provided for. Thus, while the government has recently announced healthcare provisioning on a national footing, currently healthcare in India is not accessible to all. Health is our ability to remain free of illness or disease and injuries. Apart from disease, there are other factors that affect our health. For instance, if people are likely to be healthy, if they get clean drinking water or a pollution-free environment. On the other hand, if people do not get adequate food to eat and have to live in cramped or unclean conditions, they will be prone to illness. To be healthy is being active and in good spirits in whatever we may be doing. Being dull, inactive, anxious or scared for long stretches of time or in mental strain is not healthy. In India, it is commonly known that health services cannot be given for all because the government does not have sufficient funds and facilities. Health centers, hospitals, laboratories for testing, ambulance services, blood banks, etc., that can provide the appropriate care and services to patients are required. To run such facilities, health workers, qualified doctors, nurses, and other health professionals who can advise, diagnose, and treat illnesses are needed. Medicine and equipment that are necessary for treating patients are also needed. The healthcare system in India. Following is some important data. India has the largest number of medical colleges in the world and is among the largest producers of doctors. Healthcare facilities have grown over the years. From 2,717 in 1950 to 11,174 in 1991, the number of hospitals in India grew to 18,218 in 2000. Some hospitals in India that can be considered the best in the world get a large number of medical tourists from many countries for treatment. India is the fourth largest producer of medicines in the world and is also a large exporter of medicines. However, there are several problems in the healthcare system. As several doctors settle in urban areas, there are few of them in rural areas and people have to travel long distances to reach a doctor. Patients usually have to wait in long queues in government hospitals. A disease like tuberculosis claims about 5 lakh people every year since independence. Almost 2 million people suffer from malaria every year, and this number is ever rising. There is no clean drinking water for all. 20% of all communicable diseases such as diarrhea, worms, hepatitis, etc. are waterborne. Half of all children in India do not get adequate food to eat and are undernourished. Thus, the country has sufficient experience and knowledge in running a public healthcare system. This is a system of hospitals and health centers run by the government. It has the ability to look after the health of a large section of its population scattered over several hundreds of villages. Also, in medical sciences, several advancements have been made. Public healthcare. Healthcare is of 2 types. 1. Public health services, and 2. Private health facilities. Public health services. The public health service is a chain of health centers and hospitals run by the government. These are linked together to cover both rural and urban areas and can also provide treatment to all kinds of problems, from common illnesses to special services. According to our Constitution, one of the primary duties of the government is to ensure the welfare of the people and provide healthcare facilities. The government must safeguard the right to life of every person. At the village level, the health centers usually have a nurse and a village health worker each. They are well trained and work under the supervision of doctors at the primary health center or PHC. Such a center covers many villages in a rural area. At the district level, the district hospital also supervises all the health centers. Large cities have many government hospitals and also specialized ones. This health service is public, as the government has established these hospitals and health centers to fulfill its commitment of providing health care to all citizens. These services are run from the taxes that we, the public, pay to the government. Hence, such facilities are meant for to be given to everyone, either free or at a low cost, so that even the poor can afford it. Public health service also helps take action to prevent the spread of diseases such as TB, malaria, jaundice, cholera, diarrhea, chikungunya, etc. Private healthcare. Private health services. This is a wide range of private health facilities available in our country. In the urban areas, such as cities and towns, a large number of doctors run their own private clinics. Many of them even provide specialized services. There are many privately owned and run hospitals and nursing homes too. There are many laboratories that do tests and offer special facilities such as X-ray, ultrasound, etc. There are also many shops from where medicines can be bought. According to UNICEF, more than 2 million children die every year in India from preventable infections. Private health facilities are not owned or controlled by the government. Unlike the public health services, patients have to pay a lot of money for every service that they use in private facilities. Presently, private facilities can be seen all around. In fact, now several large companies run hospitals and some are engaged in manufacturing and selling medicines. Privately run medical shops are also found everywhere. Private services are concentrated in urban areas and expensive. Some private services, facilities encourage malpractices to earn more. Some medical practitioners even prescribe superfluous or expensive medicines, injections or saline, when simple and inexpensive medication may suffice. Sometimes women's health concerns are considered to be less important than the health of men in the family and hence are not taken to a doctor promptly. Many tribal areas have few health centers and they do not run properly. In order to avoid such issues, states like Kerala and countries like Costa Rica have developed systems that emphasize the need for a judicious and affordable healthcare system.
Summary. Let us summarize what we have learned. In a democratic country like India, all adults, irrespective of religion, their educational background, their caste, or whether they are rich or poor, are entitled to health services from the government. Health is our ability to remain free of illness or disease and injuries. There are other factors that affect our health. For example, people are likely to be healthy if they get clean drinking water or a pollution-free environment. If people do not get adequate food to eat or have to live in cramped or unclean conditions, they will be prone to illness. Health centers, hospitals, laboratories for testing, ambulance services, blood banks, etc., that can provide the appropriate care and services to patients are required to provide good health services. India has the largest number of medical colleges in the world and is among the largest producers of doctors. India is the fourth largest producer of medicines in the world and is also a large exporter of medicines. Healthcare is of two types, public and private. The public health service is a chain of health centers and hospitals run by the government. These are linked together to cover both rural and urban areas. Private health services are a wide range of private health facilities available in our country in the urban areas such as cities and towns. A large number of doctors run their own private clinics. Many of them even provide specialized services.